have to know the veins of lower limb. The veins of lower limb.
Mm.
Okay, so the veins of lower limb, if you know, then it is easy for you to explain me deep vein thrombosis or pulmonary embolism. And the veins of lower limbs, listen once again and write down these points. Veins of the lower limb, you can divide it into two categories, into superficial veins and into your deep veins.
Deep vein.
Okay, so you have
Mm-hmm.
two categories of veins in the lower limb, superficial veins and the deep veins. Which one are the
Okay.
superficial veins? Your great saphenous vein, the great saphenous vein. It is your superficial vein. Your short
Superficial.
saphenous vein, short saphenous vein. Okay, so these are your, you can say these are your superficial veins which are present superficially in the lower limb. Okay, but when you are talking about the deep veins, Rohit Kumar, when you're talking about the deep veins, your popliteal vein, your femoral vein, your tibial veins, your
Posterior
peroneal
tibial
veins.
vein.
Okay,
Anterior
so
tibial vein.
all these veins, see here everyone, see here everyone, tibial veins, anterior tibial veins, posterior tibial veins, peroneal veins, all these veins, your popliteal vein, your femoral vein, all these veins are your deep veins. Okay, so these are your deep veins. So veins of the lower limb, if anyone is going to ask you the veins of the lower limb, it is divided into two categories, superficial veins and deep veins. Okay,
Deep vein.
superficial veins are your great saphenous vein, super and your short
Small
saphenous
stuff.
vein,
Short.
short
Mm-hmm.
saphenous vein and great saphenous vein. Your deep veins are your popliteal veins, your femoral veins, your tibial veins. See here, this is your anterior tibial vein, posterior tibial vein, peroneal
Posterior
veins.
tibial vein.
All these
Peroneal vein.
are your deep veins. Deep profunda femoralis vein. It is also your deep veins. So these are your deep veins. Okay. And now these veins, why they are important? Because in these veins, there is a development of deep venous thrombosis, varicose veins. Now, if you draw here one diagram yourself, see here, everyone. There is a dorsal venous arch present. This is the dorsal
Mm-hmm.
venous arch. Dorsal venous arch. Okay, so this dorsal venous arch, okay, dorsal venous arch, this is forming here, okay,
Mm-hmm.
in your foot region,
Medial
dorsal
side.
venous arch.
Mm-hmm.
Okay, and from dorsal venous arch, see here, you have two veins present here, like this. You can
Mm-hmm.
draw it like this. Okay, these are your medial marginal vein on the medial side, medial marginal vein, and this is your lateral marginal vein. Okay, so medial margin vein and lateral marginal veins. Okay, medial marginal vein around the medial malleolus. This is your medial malleolus. Okay, this is your lateral malleolus. So it is along your medial side, and from
Yeah.
here you have your vein is going upward like this. Okay, and this vein which is present on the medial side, it is your great saphenous vein. It is your great saphenous vein. So see here, dorsal venous arch, medial dorsal venous arch. Then it is having this vein is forming, which is your medial malleolus vein, okay, which is present. And then from here you have your great saphenous vein. So you can say that great saphenous vein, it is present anterior to your medial malleolus. Here you have a structure known as medial malleolus. Okay. Here you have a structure known as medial malleolus. So anterior to this medial malleolus, your great saphenous vein is passing now. So it is present on the medial side. Okay. It is present on the medial side. Now coming into the lateral side. In the lateral, from your lateral, you can say your lateral marginal vein, your short saphenous vein is coming. See,
Mm-hmm.
so this is your short saphenous vein. short saphenous vein. Okay, so this short saphenous vein, now here I am going to draw your, this is your, you can say your superficial veins. Okay, now I am going to draw in another color deep veins. Okay, I will take green color. So here you have your tibial veins, peroneal veins, okay? All these veins are joining together here, forming one single vein, okay? In the popliteal
Popliteal vein.
fossa. And that
Mhm.
vein will be known as popliteal vein,
Popliteal vein.
okay? That is known as which vein? Popliteal vein. And
Popliteal
now,
vein.
see here everyone, see here everyone. This your short saphenous vein, it is entering or draining the blood into your popliteal vein.
Popliteal vein.
Okay, so it is draining the blood into the popliteal vein. So this is, so you can say that short saphenous
Mhm.
vein along with the popliteal vein, it is forming here a junction, which I draw here in the red color. This junction is known as what?
Saphenous
Saphenopopliteal junction.
junction.
This is known as saphenopopliteal junction.
Cephalopopliteal junction.
Okay. This is your saphenopopliteal junction. Now here you have your femoral vein, then you have your deep femoral veins, other veins now. Now this femoral vein is going upward, and now see here another junction is forming here.
Mm.
Second junction. And this second junction which is forming between the great saphenous vein and your femoral vein. This is your femoral vein. I can write it as femoral vein. So this is your femoral vein. This junction is known as
Saphenophomal junction.
saphenofemoral junction.
Femoral junction.
Okay, this is which junction? Saphenofemoral junction.
Saphenophorum junction.
Okay, and now these veins, see here. Now this femoral, your great saphenous vein, it is draining the blood into your femoral vein. Now this femoral vein is now going upward when passing through the inguinal ligament. This green which I show here, this is your inguinal ligament. Now it is going to form external iliac vein. External iliac vein is
Iliac
going
vein.
to join together with internal iliac vein,
Com
forming common iliac vein. Common iliac vein on
common iliac
both
vein.
sides are
Inferior
going
vena
to
cava.
form your inferior vena cava. So this
Vena
is your
cava.
whole. See here, everyone. Rajesh, this is your whole veins of the lower limb. Once again, I am revising for you, Rajesh. Veins, superficial vein, deep veins. Superficial vein, great saphenous vein, short saphenous vein. Great saphenous vein on the medial side. Short saphenous vein on the lateral side of your
Lateral side.
lower limb. Okay. Deep veins are your popliteal vein, femoral vein, tibial veins, peroneal veins. Okay, so in your foot region there is a formation of dorsal venous arch. This dorsal venous arch, it is forming two veins, lateral marginal vein, medial marginal vein.
Medial
Medial
marginal vein.
marginal vein, from medial marginal vein your great saphenous vein is forming, which is present anterior to your medial malleolus.
Medial
This
malleolus.
structure, this is your medial malleolus, and now it is going upward. Now it is draining the blood into the femoral vein, and this junction is known as, Rajesh, this junction is known as saphenofemoral junction.
Femoral junction.
अच्छा
Okay, this is saphenofemoral junction. And your on your lateral side, your lateral malleolus vein, it is forming short saphenous vein which is draining the
Short
blood into
saphenous.
the popliteal vein. Okay, and this
Mm.
popliteal vein and this junction between the popliteal vein and short saphenous vein, it is known as
Sphenopolyt.
saphenopopliteal junction.
Popliteal
This is
junction.
known as saphenopopliteal junction. Okay, so this is your saphenopopliteal junction. Now see here, Rohit. Now between this, you can say deep veins and your superficial veins, there are some other perforators are present. See here. One perforator. Perforators are the veins which is connecting your superficial veins with the deep veins. Okay. So see here, in the mid thigh region, you have one perforator. Above the knee, you have one perforator. Below the knee, you have another perforator. There are many perforators present, but 3, 4 perforators you must have to know. Okay. So see here. Number one, mid thigh perforator. This one, this mid thigh perforator, it is known as mid thigh perforator. It is known as Hunterian perforator. Hunterian perforator. This perforator which is present above the knee, Dodds perforator. This perforator which is present below the knee, it is known as Boyd's perforator. Okay. So Boyd's perforator below the knee, Dodds perforator above the knee, and then you have Hunterian perforator which is present in the mid thigh region. There is also another perforator known as Cockett's perforator. Okay, that is your supra ankle perforators here in the leg region. Supra ankle perforators. Okay, so what are see here? So these perforators, their function is that they are connecting your superficial veins with the deep veins. Okay, so now see here. So if anyone is going to ask you what is deep vein thrombosis, deep vein thrombosis, DVT, first thing which you must have to tell that most common site of the deep vein thrombosis, it is your calf veins, or it is also known as soleal veins. Okay, soleal veins. So these veins are going to form your deep vein thrombosis. Okay, and deep vein thrombosis, which you must have to remember, that is the Virchow triad. Okay, Virchow triad. And what is Virchow triad? Three things are present in the Virchow triad. Number one, endothelial
Endothelial
injury. Endothelial injury. Number two, stasis.
status.
Stasis. Blood flow is not going properly. Stasis. Normal, not normal blood flow. And number three is hypercoagulable state. Hypercoagulable state. Okay. So three things are present in Virchow triad. So if anyone is going to ask you deep vein thrombosis, you have to tell him about the Virchow triad. Virchow triad is what? There is a damage of endothelial cells, blood stasis, and there is hypercoagulable state which will increase the risk of your thromb formation in your deep veins. Normally what happen? Superficial veins throw the blood into your deep veins. Deep veins have muscles. These muscles will pump, and now they will throw the blood into your superior veins. Okay, so here you have a muscles present. So these muscles will contract these deep veins, and now it will throw the blood against the gravity into your femoral vein into your external iliac vein will throw the blood into your inferior vena cava. Okay, so most common site it is the calf veins or your soleal veins, but most common site of DVT which will cause the pulmonary embolism, it will be your large vein, this vein, and that is your femoropopliteal veins. So if the DVT is occurring in the, see here, if the DVT it is occurring in your femoro, or you can say the thigh veins. Okay. So if DVT is occurring in the thigh veins, that is your femoral veins, your popliteal veins, please remember it results in pulmonary embolism. It results in pulmonary embolism.